Hi, everybody. It's Monday. It's 4 p.m. It's that time we come together many times a week and remember that we're going to get through this and we're going to get through it together. We've been saying that for a lot of months now. In the beginning, we felt like surely the end of this thing is right around the corner. And we realized it wasn't, and it was going to be a long road. But as we're here today, and we're going to share some more vaccine news later today, we know the end. It's out there. We can see it, we can feel it, but it's still months away. And until then, we've got to continue to do the right things to protect one another, but knowing that we work hard, we save lives of those around us, we do what we have to do to tamp down cases, ensure we have the healthcare capacity we need, and we're going to make it through this. Today, I'm wearing the mask for Ashland Independent School District. We appreciate everything they do to help keep their students safe. So last week, we passed a couple of tough milestones. We passed 200,000 cases. It's from March 6th to the present. And we also passed 2,000 Kentuckians who we have lost to this virus. So today, we held a remembrance of those 2,000. You may remember that we've held two remembrances during the course of this pandemic before. And in each one, we hung a wreath. And in each one, it was just a very small group there. But it was meant for everybody. And we both, through photographs and through posting it online, provided everybody a chance to see it. Today's was pretty special. Today, we hung a wreath on the very front of the Capitol in honor of these 2,000 lost Kentuckians. Those are 2,000 special souls that aren't on this earth anymore. 2,000 families that are struggling with a virus that probably meant that they were alone or without their family at the time of their passing, and an evil virus that doesn't even let family properly mourn afterwards while they are burying those that they love. Today we had soloist Keith Dean, who was remarkable. Reverend Jack Brewer, who gave a special prayer. The handbell ensemble from the First United Methodist Church in Frankfort, which has rang those bells every time we've done a memorial. And then we had Chris Perry, who talked about the loss of his brother, Rob Perry, to COVID. And Rob's daughter, Destiny, was there too. This is posted online, and I'd really like you to watch Chris's words, talking about how much he loves and misses his brother and Destiny's dad, but also how important it is to wear a mask and protect those around you. Chris is actually really direct and also very vulnerable, sharing his pain, but also sharing his frustration and everybody needing to do their part. So this is a chance not to listen to me, but listen to him. Listen to somebody who's lost a brother, and Destiny, who has lost a dad. It was very moving, and while people couldn't be there to be a part of it, we'd like you to watch it online and be a part of it. 2,000 individuals we've lost. Let's make sure we don't lose another 2,000 before the end of this pandemic. Preventing that is in our control. We love our neighbors as ourselves. We do what it takes to take care of them. Cloth mask, 6 feet of distance, and washing your hands. Isn't that hard when it protects the lives of those around us? All right, so we just finished another week. Remember, we calculate weeks and compare weeks. Our weeks start on Monday, so we just finished our last week. And if we put up the stair-stepper chart, we're looking at each week. The bad news is we had more cases and more deaths last week than ever before, and that's bad news. Those are Kentuckians we can't get back, and we have far too many cases right now. If there is some good news, it's a little hard to see in the chart. It's that the rate of growth last week was lower than what we have been seeing in the exponential growth that we've been trying to stop. And if you look at the second line, not last week, but the week before, that's the week of Thanksgiving. And we certainly believe some of its cases were pushed to last week because of some labs being closed for multiple days. And so we hope that the rate of growth has been slowing over the last 3 weeks as we look at this. And if that's the case, and if that's what we see this week, it's really good news. Now, that's relative, right? Because if we are having 25,000 cases in a week, if we're having 20,000 cases in a week, that's still significantly straining our healthcare capacity, and it means we lose far too many people. But we have to stop this exponential growth, and we're at least seeing some early signs that the steps we are taking are working to do that. We just have to hope and watch to see how many of our families got together in big groups in Thanksgiving and how much of an impact that may have that we haven't seen yet. We look at our test positivity, and I think we are seeing the same thing. So last week was the highest test positivity since back in May when we didn't have all that much testing, and we were just asking those that we were already pretty sure were positive to get that test. To give you an idea, we were at 9.75% last week, but we were just at 9.24% the week before. And when you look back over the last 4 weeks, we went from 8.8% to 9.75%. We don't want to increase by almost 1 percentage point, but the 4 weeks before that, we went from 4.56% all the way up to close to 8%, right? So again, we're going from a growth in positivity of almost 4 percentage points to maybe 1%. We got to slow down the train before we stop it and before we turn it around. But again, this says what the White House task force told us and what we saw in the research from U of L, from their School of Public Health and others, is that the steps we're taking work. So please, this is the last week of the executive order, and we don't foresee extending the executive order as it applies to the restaurants or bars or gyms. Please, give it all you've got this week. Don't be the groups that aren't complying. If you're the one restaurant in town that's open, you're certainly spreading COVID because everybody's going to the same place and taking their masks off. And many of those that would go right now when your Commonwealth is asking you to do your duty and fight this thing are those who might not take the normal precautions they need to anyway. So please, everybody do their part this week. It could be that this is the time in the third wave, just like what we did in July, that we were able to slow it down and plateau it. And this time we're definitely going to need to turn it in a downward trend. But at least some real hope that we are having an impact on this virus right now. But still, a lot to do and a lot of people who are suffering. All right, let's give you a vaccine update. So last week, we talked about the really great news. And hold on with the slide for just a second. The great news was that we were going to get our first allocation of vaccines, that the vaccines are really effective, and that we believe they could potentially be administered by December the 15th. That's right around the corner. This Thursday, the FDA meets to consider emergency authorization for that Pfizer drug, which is the first vaccine that'll be on the market. And came the tougher part. We don't have that much. First allocation is just 38,025 doses. And to activate our long-term care program with CVS and Walmart, we have to allocate almost half of it to that program. That's a really important thing. Almost 66% of our deaths in Kentucky are in long-term care. That's compared to 40% for the rest of the nation. Per capita, we've been doing so much better than just about any state in preserving life here in Kentucky. But it's disproportionately falling, and it's because we're doing a better job with other populations on long-term care. So we want to be aggressive. about vaccinating as quickly as possible that population. And that's why we have to engage that program with Walgreens and CVS immediately. Otherwise, there'll be a lag time in when that can get out. So that only left about a third of that initial allocation to begin the most needy of healthcare workers. And that's pretty tough, right? Because that's not nearly enough. Complicated on top of that, you can't break up the Pfizer vaccine for purposes of shipping into orders smaller than 960. So all of a sudden, we have a whole lot of hospitals and groups out there that want to be a part of the first round, and we can really only provide it to about 11. So it was going to be a challenge the whole time. And yes, everybody who wasn't announced as one of those first 11 is upset because they want to protect their people. That's natural. But we're going to face this problem, which is a good problem to have, the entire time we're waiting for vaccines. And right now it might be hospitals, but right after that, it's going to be, how quickly can we get our EMS workers? After that, it's going to be, why does this school system have a vaccination day that's a week before that school system? We will never have enough of this to do everybody that's similarly situated at the same time. So we're going to have to ask for patience. And it's going to be the hardest patience that anybody could ask for, because you're worried about losing somebody between now and when we could get the vaccine. But there is not enough to go around to everybody all at the same time. So we really need your help. We need your leadership, even if you're not in that initial trough. So here's the good news. Let's put up the slide. We believe that there may be as many as 5 separate shipments between the 2 vaccines in December alone. And that would be really, really good news. So that first week, we talk about December 15th, that going out to the 11 facilities, and you think, we really wanted to be a part of that first week. Well, it's our hope that very next week that we get our first shipment of Moderna vaccinations, and it's almost twice as much as is available that first week. Even better, it doesn't require the deep refrigeration. Even better than that, we can break it up into groups of 100, meaning we have more flexibility to get this second allocation out to more places. So if you're one of the facilities that's disappointed that you didn't get in the week of 13th through the 19th, probably the 15th, we may, and this all depends on the federal government, be able to get you your initial group as early as the very next week. So work with us. And again, know that there is never going to be as much as we want at the timing that we want it. Here's some other numbers. And these are all for Moderna, what the federal government has told us. They have given us these exact numbers. That doesn't mean that they won't change. But if the federal government changes, we'll let you know. So the first week that we get Moderna vaccines, we're going to get 76,700. We're told that the very next week we'll get another 33,800. So about 100,000 initial doses of the Moderna vaccine. We believe in December. The worst we think right now that it happened is that could bleed into the first week of January. And these are all the first doses. So the federal government tells us that they are holding back the second dose, the booster. And for Pfizer, they will ship that 3 weeks after the initial dose. That's when it needs to be provided. And it's 4 weeks after the Moderna. Now, what's not shown on here is we believe that we are going to have 2 more shipments of the Pfizer vaccine. We also hope that those are in December, but we haven't been given firm numbers. All we can do right now is estimate on the numbers that they say overall they're going to have based on our allocation the first time, but I want to get more detailed numbers. I want the federal government to put that into the system because I feel like we can rely on that a little bit better before we provide that information. Now, even if we get those extra 2 shipments from Pfizer in December, there is only going to be enough for long-term care, which again, we want that vaccination program to go as quickly as possible. If we can cut off 66% of our fatalities in the first 2.5 months of our program, oh my. And that'll be us doing something really special. And then our frontline healthcare workers, those that are impacted the most or exposed the most to COVID. So better news in how much we anticipate we're going to get, but still not getting past that first grouping, at least for December. But the more we get in December, the faster we can potentially move to other groups, January, February. So that's good news. Today's COVID report, it's hard to say that this is good news, but it's 1,972 new cases of the coronavirus. Remember, Mondays are typically our lowest days. And this is a lot of cases for the day of the week that's supposed to be the lowest day. But this is lower today's than our last 2 Mondays before it. Just about every other day I've stood up here and given this report. It's the highest Monday, Tuesday, Wednesday, you pick. This is one of the first times that I can remember that our number is lower than multiple previous weeks. It does bring our total number of cases to 202,592. That's since March the 6th. Our positivity rate today is at 9.60%. So that's just a little bit below last week's average. 1,700 individuals in the hospital fighting COVID, 410 in the ICU, 210 on a ventilator. We're going to work, because I got a question last week, which was a good question, on seeing how we can break out those numbers regionally and how they compare to overall capacity. Capacity we're going to have to base on beds because personnel, which we're worried about more staffing in the hospital, is a lot tougher for us to gather that information and engage it. If we're able to do that in the future, we'll endeavor to. New cases by county: Jefferson 343, Fayette 171, Warren 66, McCracken 55, Boone 54, Kenton 52, Whitley County 48, Woodford 44, Bullitt 43, Hardin 37, Campbell 34, Pulaski 32, and then 30 in Boyle, Hart, and Madison. The others can be found at kycovid19.ky.gov, but it's everywhere, and we got to treat it like it's everywhere. We've also lost 10 additional Kentuckians today, at least one in their 60s, and what we're seeing recently is more people in that age group or below. So remember, this thing doesn't just come for those that are older, and it doesn't just come for people with serious health conditions. I can't tell you how many times that somebody said, well, they had a comorbidity, and I asked what it was, and it was hypertension. That's high blood pressure, right? How many of you out there have hypertension? Or sometimes it's diabetes. Well, we have at least over 600,000 Kentuckians with diabetes. So remember, when people talk about other health conditions, there are things a whole lot of us have. So those that we've lost today include an 89-year-old man from Allen County, a 71-year-old man from Bullock County, an 89-year-old woman from Graves, a 77-year-old woman from Greenup, a 92-year-old woman from Jessamine, an 87-year-old man from Johnson, and an 86-year-old man from Johnson County, 76-year-old man from Marshall County, and 2 Pike County residents, an 81-year-old man and a 67-year-old woman. So let's make sure, again, that we ring those bells at 10 a.m. and we light our homes and businesses up green. So the wreath that we hung today in honor of those 2,000 lost Kentuckians has green lights built in. So there's going to be an extra green light right there over the door of the Capitol, shining for these 10 lost Kentuckians. And now the 2,082 that we've lost in this COVID pandemic, remembering them. Green is the color of compassion. It shows that we care about their families, and we care significantly about this loss. It's also the color of renewal. We know that these 10 individuals and all 2,000 plus are just leaving their earthly body, and that they are moving to a better place. And renewal also reminds us that there's a better day ahead. We just got to fight for it. Long-term care facilities, 324 new residents testing positive, 268 new staff members testing positive, 87 new deaths attributable to long-term care population. This, everybody look at it, this shows you exactly why we have to vaccinate those in long-term care as quickly as possible. Incredibly important that we do so. All right, today's memorial is going to be pretty tough. Everybody take a breath, or let me take one. All right. Today we share the heartbreaking story of Rufus Mason, a 72-year-old custodian at Westport Middle School in Louisville, who passed away from COVID-19 on November 30th. Rufus received confirmation of being infected with COVID after exposure at the school where he worked. He entered Baptist Hospital on November 19, where he fought but ultimately succumbed to the virus. We spoke with his wife, Evelyn, who he was married to for 52 years. Evelyn had also contracted the virus, but is thankfully doing much better and was able to share her husband's story with us. She said Rufus was the most kind, gentle, caring soul, and everyone knew and loved him. He enjoyed staying busy and active, working for Ford Motor Company for 40 years before retiring in 2009 and joining the Westport Middle School team. Evelyn shared the family he built at the school with faculty, staff, and students. That whole family are heartbroken by this loss. Our thoughts and prayers are with Evelyn and her family as they mourn the loss of Rufus. Today, we mask up in his honor, and we remember the importance of spreading kindness and compassion, just like he did during those 72 years. This makes me think of two things. Number one, this was the day after my birthday that he passed away. Number two, he's younger than my dad. Rufus is a special person. And he reminds us that there's nothing magical about a school building's doors that keep COVID out of it. That we have to make sure that facilities are safe for their workers, like Rufus, and that we don't make decisions that we've made lightly, and we don't make them in the absence of real concern. And I know Dr. Stack's going to talk here in just a second about some other examples we've seen that just shows you the spread. But please know we're working as hard as we can on plans for January 4th that allow schools in red zones to have some form of in-person learning. But the threat is real. We cannot pretend, put ourselves in a fairy tale that it just can't spread in one of these facilities. And we have to know that those working in them are scared, the number of people that they come in contact with every day. So we've got to make sure that there are real options, starting January 4th, that give faculty and others the protection that they need and the protection that they deserve. All right, I'm going to turn it over to Dr. Stack, who has a couple of different things to talk about, and then we'll come back and answer questions.
Thank you, Governor. My mask today is from the Veterans Program. Apparently, for the last 20 years, they've done a lunch in support of veterans, and this year that, of course, was not pandemic friendly, so they made masks for the veterans and T-shirts, and we're going to do a drive-through event. So thank you very much for the mask and for your support for our veterans, and thanks to the veterans for their service. So I have some things to add on and amplify from the governor, because I know the reporters listen, and I have to chuckle. Anyone who's overly critical of people talking to cameras every day for our little mistakes has not talked to cameras every day, because it's easy to have minor things. The Pfizer vaccine gets shipped in minimum allocations of 975 doses. The governor said 960, but it's 975, and both he and I know that. It's just a matter of keeping all these numbers in our heads as we go through this. I want to amplify what the governor said and put in perspective. We are about to have not one, but 2 vaccinations available for people less than 10 months before our first coronavirus patient was identified in Kentucky. This is nothing short of a modern medical miracle. This would be one of the wonders of the modern scientific world to do this quickly. I now need to ask everybody's patience and everybody to take a deep breath for the next few weeks. These are products that are miraculous in their science, but they require special storage conditions. They are new technology. They require us to have distribution systems to reach designated populations. The quantities are still being determined. The information changes on a weekly, daily, and sometimes an hourly basis. For example, we initially were told no one would have to have a -80 freezer, and this will be true, we believe, going forward. But for the first shipment, at least, that restriction was added less than a week before the program, before we had to put the allocations in the computer. If I were in the logistics role that General Perna is and his colleagues who are overseeing the distribution, I think this makes good sense, even if it's frustrating for folks who didn't have a freezer in time when we made our decisions. You think about having a product that is very scarce, shipping it around the country in containers that are custom created for this purpose, and having this go all over the United States. You don't want to have any of it get wasted because there's not a backup plan for the storage container if there's a problem. So that's why they added, I think, the requirement for a freezer. We will get past all of these things, and not everybody can be first in line. So I know it's frustrating. I know it's very difficult. We are doing the very best we can, and we are going to do our very, very best to make sure that everyone who wants access to this vaccine or these vaccines have access as soon as we possibly can. And we'll work very, very hard on that. Also, please don't assume just because your local hospital or your local medical group didn't get this right away that there was anything wrong they did. Nobody did anything wrong. This is just about trying to work through a very complex and very fast-moving process. And I want to thank everyone for their active collaboration, their active partnership, and ask everyone please to be a little bit gentle with our team and our staff. We've got a lot of state employees and a lot of local employees, but I'm thinking about my state employees that I get the privilege to work with every day, working extremely long hours under very difficult circumstances, trying to make sure you have access to this as quickly and as safely as we can do it. I want to talk about the schools a little bit here real quickly. The governor shared, unfortunately, about our loss in Kentucky of Rufus and the nature in which he was exposed to the virus. I'm going to give 2 other examples here. And before I share the examples, I want to make the point that I don't source this to the specific institutions or even the specific cities. And I can anticipate there's already going to be people saying, we want to know the names of the schools, we want to know the names of the locations. And I'm going to decline to provide that because this is not about trying to make anybody feel they were singled out, to be criticized, that they did anything wrong. This is about trying to share with people that it is really important and that what we're doing has basis in reality and reason for why we're making these difficult decisions to try to keep people safe, and that we also have an obligation to respect the privacy of individuals. Just because we make bad choices doesn't mean we concede our privacy. And so we really take that to heart. That's a central tenet that I swore years ago as a physician, to respect the privacy of the patients and the people I and we serve as physicians and other clinicians. So I'm going to tell you a couple stories here for schools, and some of this will be hard to follow, but just track for the overall picture. We have a school where one teacher was positive with COVID-19. They had 9 total cases that subsequently became infected, 1 person who died, and 400 contacted people. So 400 people who would have had to have been put in quarantine. Here's the narrative for this, just to tell you how complex this is. When people say, and this is frustrating for me, so I will share that it's frustrating. When we hear people say it's not our problem, our school does a great job, our district does a great job, and explain all the wonderful things they can do, It is an overly simplistic analysis of a much more complicated problem. It is a false sense of confidence that somehow our one place is going to keep everything out and everyone safe. There are consequences that go well beyond that one institution. So in the case I just told you, you have one middle school teacher who had mild symptoms. The initial COVID test was negative, but the teacher continued working. Subsequent repeat testing was positive. So we've told you the test can be too early in the disease to find the disease. And in this case, the first test was negative, but all the other ones were positive. The teacher served as the temperature screener at the school. And so they interacted with every person who entered the building while they were the temperature screener. The school also recently had an in-person all-staff faculty meeting, and it was held during lunch and included a provided meal. So masks were not worn because people were eating. And there were multiple people that were within 6 feet of each other, given the size of the room that they held the event in. The meeting was held during the teacher's contagious period, and most of the staff were required to quarantine as a result of that event. At least one non-teacher subsequently tested positive. This was the second staff member. And this second staff member subsequently exposed a large number of other people. At least one student who was in the same grade level as the first teacher subsequently tested positive and had symptoms. In that student, they took it home to their family. 3 adult family members got sick, and subsequently that person's grandparent died from COVID. So I just described a chain of events that involved one teacher, involved 9 cases, and had a student who took it home to a family member who died. The second situation I will tell you is an athletic player. We had one player who was positive for COVID, who resulted in 14 more cases and a total of 40 contacts. And school was not even in session. All right. So this could have been far, far worse if school was in session. So here's the story here. There's a teenager with respiratory symptoms, but despite having symptoms, and remember, we've said over and over, please stay home if you are sick. Stay home if you are sick and do not go to school or work or other activities until you are better. The teenager attended volleyball practice despite having respiratory symptoms. The team practiced together. All the players and coaches were exposed. 3 additional players and 2 coaches subsequently tested positive. These cases then take the virus home, and at least 3 more families are affected, resulting in at least 6 additional cases. And one of the infected family members also happens to be a teacher at the school. And as a result, at least 2 additional teachers were infected, and several more were exposed. Now, the students were not attending in-person session or classes at this period. Had they been in session, this could have been much worse. Now, there are other cases like these that are published in the CDC's morbidity mortality weekly reports and other places. I have to tell you, this is not a dramatization made for TV. This stuff really happens. And the reason it's not happening more is because we've taken so many steps to prevent it from happening more. So there is a cause and effect relationship between the choices we've made, which have been very, very difficult, and the reason there's not as much disease out there in the community. And I'm going to conclude here, on the teacher point. I get a lot of mail still, and I want to thank you, and I am very sorry. I would very dearly like to write response letters to all of you, and I just simply can't do that. But I do get it, and I read every letter and every card that comes to me. So if it gives you comfort to know that I read it, please keep sending them, because I see them. So I picked up a bunch of mail last week, and I got, here's a letter I've got, and this is from a teacher. And I'm just going to read you a few lines here. I teach, and I won't say where, and they've been teaching from home since March. It has been frustrating for me to have been hailed a hero for teaching in the spring, and now selfish and lazy because I want to stay home. I don't want to be teaching this way. It's much harder than even my hardest days in the classroom with some of the most challenging students. I have cried more and been more stressed out this year than any of my previous 8 years in the classroom. And she goes on, And her point is she has her own concerns about getting the disease and her own risk factors. And again, the operative part here is she is distressed by this divide about being hailed as a hero in the spring for teaching the students, but now being accused of being selfish and lazy because she's worried about her own safety and well-being. And I think the governor was able to share, with the family's permission, the story of Rufus, who did contact the disease through a school contact. So folks, we have got to look out for each other. None of this is easy, and we have never said it's easy, but it is necessary. And we are seeing a bright light at the end of the tunnel if these vaccines work like we hope they will. I just ask you to please look out for each other, care for each other, and hang in there just a little bit longer. I think next year is going to get much better. And my last two things, again, I thank the governor for indulging me. I still get with these letters, these occasional other gestures. Here's a family from Lexington who took their Christmas tree stump, cut them into little cylinders, and painted Kentucky on here. So I'm going to thank you very much for that. I won't mention your name. I never know when that could come back to result in consequences you don't want. And then the governor showed, I think he showed previously, the quilt makers in Berea, Kentucky Mask Makers Quilt, I think, group, sent a very nice quilt and are making masks for people who need them. And they had scraps. And so they made a teddy bear that they called Doc. And if you can see, it's hard on this camera. Sorry, I'm trying to get it there. We'll get through this together. And that's an actual functioning separate mask. So thank you very much. When I get these things, it reminds me why we work these long hours and why we put up with so many of the difficulties. It's not easy. We have a lot of people who are concerned, a lot of people who are frustrated, a lot of people who are scared. And look, I get it too. We have people who are not angry at us personally, or maybe they are angry at us personally because we've had to make these choices. But the vast majority of people understand that these choices were made with pure intent and the effort to try to help keep people safe so that we can then build back better and build back stronger when we get to the other end of this pandemic. So I want to thank you very much. I want to thank you, Governor, for the opportunity to share these thoughts and perspectives. And again, I want to remind the Kentuckians just how grateful I am to have the opportunity to serve and to share these perspectives with you, to try to help us as we get through this, to understand and hopefully inspire confidence that there are a lot of careful thought, hard work, and reasoning that goes behind all these decisions that we're having to make and undertake on all of our behalf. Thank you very much. And Governor, back to you.
Just thinking, to anybody who thinks we do the same thing every day and we do this, I give you Dr. Stack and a blue teddy bear. So let's move on to questions. I just have 2 written ones, so I'll go to those first. And then we have 10 journalists asking for an update on the Food and Beverage Relief Fund. We've now received 3,753 applications. They request a total of about $35 million. We've already distributed or are getting $12 million out the door. And so now it's just a matter of getting through and confirming those other applications. We think, again, there's a lot of submissions. We're going to be able to get those dollars out the door. Second one, I read that you have asked school officials to develop rosters of educators and school personnel who would be willing to be vaccinated as soon as possible. How does it play into our plan for vaccine distribution? And do we hope to distribute the vaccine on school grounds? What it shows is that we have made our educators an absolute priority, that we intend to reach them right after we have gotten long-term care, our frontline healthcare workers working with COVID, EMS, and then they're in that very next group. And so we want to make sure we're prepared. We hope to get more vaccine than anticipated at different points. And if we can get all those teachers and custodians and bus drivers and everybody else, cafeteria workers that are in that building vaccinated as soon as possible, we can totally change the game on safety inside of those buildings. It's still too early to suggest the logistics of where they'd be given, and we've asked for flexibility from our superintendents, but we've also asked them to be an early part of the process and in their own minds to start making plans. Because while you may hope it's on school grounds. If it comes earlier than anticipated, that's a great problem to have. And so we want to be fluid enough to be able to push folks to an off-site location too, if necessary. All right, now we have 10 separate journalists, starting with Shelby Smithson from WKYT.
Hi, Governor. There are several reports of a proposal to use a $1,500 stimulus check as an incentive for Americans to get the COVID-19 vaccine. What are your thoughts on any kind of incentive plan like that?
Well, I haven't seen that specific proposal. I think the greatest incentive for getting the vaccine is we can defeat this virus, something that's killed over 2,000 people, infected over 200,000 Kentuckians nationwide. I think we're 280,000 deaths. This is going to be more deadly than most every individual war that we have fought in. So I would hope people will get it because it looks like it's safe. It's the right thing to do. And at least the Moderna vaccine, I mean, it looks like it can keep you from getting really sick. You know, I think it's going to be interesting looking forward about large events and what those events themselves require as far as attendance, whether that's being vaccinated or not, because a large event with a group of people that have been vaccinated is going to be safe for the people there. If someone has not been, it could be very dangerous for that individual. I hadn't thought about a monetary proposal. I'd have to give more thought to it, but I'm seeing a big change in a positive direction about the number of people who want to get vaccinated. Even just this first round and it being so limited, seeing the swell of why not me? Well, that's tough and we have to work through it. It does show the hunger out there for a vaccine. Joe Ragusa from Spectrum.
Hi, Governor. So I actually have two questions, if you'll indulge me. One is following up on the bar and restaurant fund. I know you had mentioned last week, I believe, possibility of expanding that beyond $40 million if there are enough applications. It sounds like with demand, you're at least close to that point. So do you anticipate expanding that fund any further? And also my second question, also in relation to restaurants and bars, given that you feel like we can hit the December 13th, December 14th date and ease those restrictions, have you thought any about capacity limits on bars and restaurants when they will come back?
Yeah. So we do not anticipate extending the executive order as it applies to bars, restaurants, gyms. So that would mean, provided we don't extend it, and I don't anticipate or plan on extending it. Let me just say that they would be able to return to the 50% capacity they were at before. Expanding beyond that right now isn't the right thing to do. And let me just add that when coming back, we need everybody being militant about the mask mandate. You know, it's a place where people come together and take off their masks is exactly where COVID wants to spread. So what it means is every minute you're not eating or drinking, you need to have that mask on. And if you don't enforce it, then the areas become unsafe again. So we are willing to increase the fund if we have more than 4,000 bars and restaurants that apply. Right now, being at 3,500 suggests we might. As long as we go over that amount and they qualify, then we will add to that fund, certainly. And I don't know whether it will exceed 4,000 or not. We'll see if it comes in. Kevin Wheatley from WDRB.
Hi, Governor. I have a couple questions myself. I know you said that you don't foresee extending this bar, restaurant, gym executive order. I'm wondering why that doesn't apply to schools, since they may be able to get middle and high school students in on January the 4th. And secondly, I know that you all provided some anecdotal evidence today about spread within schools, but what sort of broader data have you relied on to say that closing schools to in-person instruction is right to do, whereas you can keep other things open right now?
As far as schools, for most, there'd only be 5 instructional days. After the 14th, we believe that it is wiser for us to spend the extra time before January the 4th, coming up with the extra steps and need to be able to have some form of in-person instruction in red counties. And Kevin, what we have relied upon is a standard that we put out and the education community agreed to on the color coding map for counties. What we used an incident rate that the CDC endorsed. And they said when you are below, when you're not red, when you're below, I think it is 25, then community spread is not overwhelming facilities like schools. But once it is over that, it's unsafe everywhere. That was the tool they put out, and they haven't brought it back. We said we were going to use that until positivity was over 6%, but we stuck with it when positivity was over 6, over 7, and even for a while over 8. So we made the decision based on the exact tool we were using and based on the fact that we were seeing other facilities overwhelmed that have more defenses in place. Nursing homes that have 3 tests per week, significantly more PPE. When we made the decision, almost all of the state's school districts had already gone remote based on what they were seeing in their own areas, and all of us anticipating a post-Thanksgiving surge. This was a way to prevent that from being absolutely magnified and amplified. So the answer is we were using the tool that we all agreed to use to ultimately make that decision. Catherine Collins from WLEX.
Thank you, Governor. I am wondering if you think the latest case report numbers are evidence that these new restrictions are working. And also, I believe, if I'm remembering correctly, Kentucky, since the beginning of the pandemic, has seen multiple plateaus, but hasn't really seen a real decrease in cases. What has to be done to not only plateau right now, but to see a decrease?
Tell me, Catherine, can you repeat the first part of that question? I know we were talking about the plateau and the decrease, but can you ask the first part again, please?
Yes, just the latest case numbers. Are they evidence to you that these new restrictions are working?
Whether the restrictions are working. Yes. Yes, we believe the new restrictions are working. They worked in July. They worked in March. They worked in Kentucky. They worked in Arizona. They worked in Texas. They worked in Florida. They worked in every place that they have been instituted, and they have been instituted in other states because they work. You're right. We have only plateaued this virus in other times. Now, we haven't been anywhere near as high as we are right now, and it's an aggressively spreading virus. The numbers that we are at now to decrease is pretty simple. We got to wear a mask. We got to wash our hands. We got to engage in social distancing, and we got to do it 100% of the time. Our neighbors coming over aren't safer than anybody else. We got to do it then. We always talked about hands, face, and space. But then we all also have to live up to our duties when it comes to that. If we have an establishment, it could be retail, it could be restaurant, it could be an office building, it could be any of it. We have to make sure everybody inside it's wearing a mask every minute that they need to. Now, that is not comfortable, but none of us want our facilities, our places, our businesses to be where the virus is spreading. And if people come together and take off their masks, the virus is spreading. Now, you may say, I don't want them to yell at us. Okay, but that means you're letting whether someone's going to yell at you be the determination of whether they can spread it to other people at your business. So we need a lot more enforcement, but we need a heck of a lot more personal responsibility. If you watch the memorial we did today, and you see the family see the individual talk about his brother Rob, he talks about an individual that didn't think he needed to wear a mask and wouldn't. And then you'll hear him talking about his brother pretty much on his deathbed saying, if I ever get out of here, I'll never go out of the house without a mask again. He didn't get that chance, but we can. So you don't have to hear that from me. People maybe hear from me too much. You can hear it from him. We've got that link up. Tom Latek from Kentucky Today.
Thank you, Governor, and good afternoon. There have been reports of cyber attacks over the last couple of months on hospitals, and IBM is now saying that these same cyber attackers, if you will, are going after the distribution system for the vaccines. Are you aware of any instances of hospitals affected by the cyber attack earlier? And is our system safe from cyber attacks to get the vaccine distributed?
We don't know of any individual hospitals or other systems in Kentucky compromised, but it is absolutely happening. So there are countries out there that want us to fail and want our people to die. And you can identify a whole bunch of them: Russia, Iran, North Korea. You can pick a couple others. And they are doing a number of things right now to try to divide us or hurt us. These types of cyber attacks are one. They want to make it harder for us to get people the vaccine. But the other thing they do is they spread disinformation on the line, that masks don't work. Well, of course they work, that it doesn't spread in certain places where it spreads, that it's just a conspiracy and it'll end after the election. Well, the election's been over a little while. All of those things online, the countries that hate us, that want to defeat us, the ones that we as Americans are supposed to oppose the things they do. Well, they're out there spreading that disinformation, and some people out there join them. And while they say it's American liberty, but you're working with the enemies of America against Americans, costing American lives. So everybody out there that thinks they need to be a patriot, do not help these countries in any of the things that they are trying to do to harm us. They are real. They want as many of us to die as possible, and they want us to be as divided as we possibly can. I think we're stronger than that as Americans. Josh James from WUKY. Do we have Josh? All right, let's move on to Stu Johnson from WEKU.
Thank you, Governor. Do you anticipate, I guess, meeting with legislative leaders from the House and Senate between now and January on coronavirus or any other issues that might come up during the session?
We've already started meeting on the budget, and that's included meetings with myself and legislative leaders. It touched on other issues in that. Talked with them, and we'll continue to talk with them about the vaccine plan. And I've talked about a number of other issues that may come up. Some of those conversations are had with Rocky or with John Hicks, who we've made available. He is the budget director. But having those conversations now. Debbie Yetter from the Courier-Journal.
Hey, Governor. What are you hearing from hospitals in Kentucky about capacity? And do you have any kind of a yardstick? I know, for example, California is looking at 15% of ICU capacity to trigger some of their shutdowns.
So what we hear from them is that they are not at capacity, but they are concerned about capacity, that the rate of growth is what makes them nervous. We see different groups making different plans. Only a couple of them have had to pause elective procedures. I really think what will really sound the alarm, and we watch all the other numbers, is if we see more or even all systems starting to pause those procedures in different ways. But our hospital systems communicate regularly, weekly, with the Department for Public Health. They've taken really responsible steps when we've gotten there. Certainly, we are concerned about ICU and ICU capacity. We're watching that carefully. And in fact, some of our earlier numbers on ICU available beds had the NICU beds in them, which obviously you can't use for adults. So we've had to, if you will, change the denominator for how many of them are full. And so it's a watching the data every day, but we are watching just as much about the growth as the overall number. And again, we hope that we are seeing the numbers leveling off a little bit. But now it's Monday, and sometimes the numbers that are reported on Monday are a little bit lower, and Tuesday you'll see a bigger jump. We're going to try to get you some regional numbers. We hope tomorrow about where ICUs and hospital beds are, because some regions are feeling a bigger pinch now than others. Now we have to be able to work together to push people out where they can get the better care. But it can be a real problem if even just one region has their ICU beds filling up too quickly. Alex Ebert from Bloomberg.
Good afternoon, Governor. Thanks for answering our questions. Indiana Governor Eric Holcomb is holding his restrictions through the end of the year. Governor DeWine is keeping his 10 p.m. curfew, and he says that he'll extend it. And Governor Whitmer in Michigan has said that she's going to put another 12-day extension on the bar, restaurants, and entertainment venue no in-person service order they have there. Why are you planning to not extend your in-person restrictions on dining in bars? Can you walk us through what you're seeing, what you're thinking, what your logic is?
Well, what we're looking at is what we did in July, where we took about 2 weeks, the same period of time. And this is a little bit longer than that, about getting through multiple cycles of the virus and then coming back more motivated. And certainly we hope to see more motivated to enforce that mask mandate. We saw that has worked in the past. When we put this out, we intended for it to be time limited and believing that we can have a major impact on the virus if we get through 1.5, or 2 potential rounds where it would spread. Now the CDC has changed some of the times that it thinks that takes, from 14 to maybe 10 to maybe even 7. If it's 7, and we think it's more like 10, then we've gotten through 3 or 2 or 2.5 of those cycles. We do think we are seeing a slowing of growth. And while we're all at different times taking these steps, I think what we continue to hear from the CDC and others is we need major behavioral changes outside of that. You know, it's a little heartbreaking given the pain that's out there, the economic pain, and certainly the pain and health and loss of life, that if we could all just wear a mask and keep our distance, wash our hands, then we wouldn't even have to have some of these capacity restriction limitations. Now, as it applies to Indiana and Ohio, when this order ends, we are still at or below the capacity that they have set for these same places. In fact, you've seen a lot of states that have said, okay, we're going to go to 50% for bars and restaurants. We were already at 50%, and we'll be back to it. We do need it to be a more responsible 50%, but this was an attempt to kind of shock our system, to slow the growth. And we at least hope that we're seeing that. And without Thanksgiving, I think we know that would be happening. We just need to see if we haven't seen that Thanksgiving data yet. Melissa Patrick from Kentucky Health News.
Hey, Governor. It appears that the coronavirus contact tracing program was designed largely by or for local health departments and has fallen a bit short of providing the call for broader, more detailed epidemiological data. That said, do you think that these current data challenges suggest a need for a more centralized public health system in Kentucky instead of the one that basically supports 61 independent health departments?
Our local health departments work really hard, and they do a really good job, and they are connected to their communities, and I am so proud of them. I think the way that we share information, the way that we collect information needs to be more uniform. And I think that they agree as well. It's a little harder in the original system that we had out there, but we're getting closer and closer to it. But I do want to comment again on the narrative that's being pushed on contact tracing. The number one point of contact tracing is first to reach out to the individual that's positive and make sure they don't spread the virus. In other words, that they get a call and they say you're positive, don't go to the grocery store. I can't tell you the number of people that might otherwise go to the grocery store without that individual on the phone telling them that. That stops a person who is positive from spreading the virus, which means it fights back against the disease. The second purpose is to reach out to the contacts that those people have seen recently and ask them to quarantine so they don't get out and spread the virus. Now, those are the two primary purposes of stopping the spread going forward. And what we're talking about is going backwards and getting data. We are in the middle of a battle to stop this thing from spreading wider. And if that means we put more focus on stopping it from reaching and potentially killing more people than being able to say in these 34 examples that came from X, then yes, we're doing what we have to do. We are not in a sterile work environment or lab getting to design how to do this. We are in a real life, every day, trying to prevent people from coming to harm. And again, these have been calls for data in areas where every national expert tells us the same thing. And so if we don't believe that it was spreading in these places, ask the White House for their data. I'm sure they could give you everything that they have been relying on. But still come back to those who think that we don't need contact tracers, to how alone would you feel if you got an email saying you had COVID, nobody ever called you, ever? Because our contact tracers also put you in a system that says, do you need food assistance? Do you have a doctor? Who do you call? Here are the symptoms you need to monitor. A lot of people get this and feel okay, and fall off a cliff. What if you don't know that that's possible and that it's coming? Our contact tracers have worked so hard and they have to hear so much pain. And I know the attacks are intended to be on me, but they feel those too. And the local health departments feel those too. So let me just finish where I started. To every local health department employee, to the contact tracers we hired, to those in the Department for Public Health, to our EMS folks, to our people in our hospitals that are dealing with COVID, thank you so much. Kind of like the letter that Dr. Stack read, those that were hailed as heroes are now sometimes yelled at, and that ain't right. You are heroes. But doing something heroic means that you're not always recognized for it when it's happening. Keep working. You're saving lives. Doing good things is supposed to be hard. We'll be back tomorrow at 4. Please get online and watch the memorial from today. I think you'll find it's moving. And listen to the message that Chris provides in particular, along with Destiny, who was so brave to be there after the passing of her dad. But she cares about the people of this Commonwealth. Teacher herself, and knew it was the right thing to do. Their example is pretty special. Thank you all very much.